While the number of people who live with untreated mental health issues without any help is dwindling, it's not uncommon for someone in need of mental health treatment to go years before seeking out treatment, if they even do at all. There are many misconceptions about mental health, making it difficult for some people to consider getting the help they need. In this video we will explore a few common mental health myths, and provide information on getting the treatment necessary to improve mental health and mental health awareness. 1. Mental illness is solely caused by bad parenting. Blaming parents for their children's conditions leads to an unfair bias against those struggling with mental health problems. While some mental health issues are directly related to poor or absent parenting, several contributing factors are likely to cause the onset of disorders such as schizophrenia. Genetics, environmental factors like living in poverty or exposure to viruses during gestation, and brain development before birth can also affect mental health. While some individuals may never find relief from certain conditions, many people get better after treatment. Sometimes patients can get better without medication. This can be due to changes in lifestyle that include stress reduction techniques and therapy. 2. Mental health problems aren't common. Mental health problems affect more than 1 in 4 people in the United States. Mental health problems can be serious and disabling when left untreated. But with appropriate support, many people who have mental health problems can go on to live full, active lives that are productive and satisfying. 3. People are supposed to recover quickly from a mental health issue. Recovery from mental health problems can be slow and often takes a lot of time and hard work. Many people will need long-term treatment to garner positive change. With sufficient treatment and time, the quality of individuals with mental health struggles typically improves. Recovery from mental illnesses may take months or years. During this process, many people can and do live satisfying lives with proper treatment and support. 4. Only certain types of people have mental health problems. While someone's risk for developing a mental illness may be influenced by their social environment, genetic factors, or trauma, nearly anyone can have a mental health problem. There is no specific personality type or characteristic that can protect someone from not being susceptible to experiencing mental illness. 5. People with mental illnesses are violent and unpredictable. The vast majority of people who suffer from a mental illness are no more likely to be violent than anyone else. However, some individuals with certain illnesses may have an increased risk of becoming aggressive or violent. People with severe mental illnesses are over 10 times more likely to be victims of violent crime than the general population, and this risk increases when substance abuse is involved. 6. Children and adolescents can't have a mental illness. Mental health problems in children and teens are common. About 1 in 5 kids in the US experienced or will experience 1 or more mental illnesses over their lifetimes. These conditions can cause significant problems if left untreated. Still, early intervention before things take a significant turn has proven effective for many disorders, including depression, anxiety, and even some disruptive behavior disorders. Many other issues may develop during childhood, such as eating disorders or relationship concerns, and it's important to have a primary care doctor or qualified therapist that you can talk to about your child's development and behavior. 7. Medication is the only way to deal with mental illness. While medication may effectively relieve some of the symptoms of mental health problems, they are not the sole treatment option. Therapy is an important part of a holistic approach that includes understanding and managing symptoms, finding healthy outlets for frustration or anxiety, and developing and practicing problem-solving skills. Research has also shown that regular physical activity boosts mood by increasing endorphins, chemicals in the brain associated with elevated mood, while decreasing anxiety and elevating certain biochemicals related to serotonin production. Regular exercise can also boost self-esteem and decreases stress and mental health symptoms. 8. Therapy is for crazy people. Therapy is a common treatment option that helps many people better manage their mental health problems by providing a safe, supportive space to work through issues and to learn coping skills to handle stress or negative feelings in more effective ways. It's not just for people with severe disorders like schizophrenia. People who suffer from mental health challenges may benefit from social support outside of the therapeutic environment. Still, therapy can allow individuals to reflect upon their thoughts and behaviors to improve relationships at home, the workplace, help to resolve internal conflict, or to achieve a healthier lifestyle. 9. Therapy takes a long time and isn't effective. Depending on the type of therapy, treatment length or number of sessions per week varies, but shorter options can fit into people's busy schedules. Cognitive behavioral therapy, CBT, is one evidence-based option that can consist of a limited number of visits over a relatively short period. For example, 12 to 16 weeks of sessions for mild to moderate depression and anxiety can be used to improve symptoms. CBT can also be completed via phone or online chats with a mental health professional if someone prefers more flexibility in scheduling their appointments. Also, keep in mind that some treatments take longer. For example, psychodynamic therapies may require up to 20 hours per week over several years rather than months. It's important not to be discouraged by a course of treatment that seems too long or difficult in the beginning. 10. It's possible to smell schizophrenia. Mental illness and disorders can only be diagnosed with the help of medical records or physician reports and indications that symptoms interfere with daily life and relationships. This goes for schizophrenia, an insidious and chronic mental health problem that may have early warning signs, including hallucinations, disorganized thinking, or delusions such as paranoia which cannot be determined simply through someone's body odor. In fact, individuals who suffer from schizophrenia may hallucinate, but may in fact experience or sense strong smells and odors in their environment. Schizophrenia also requires evidence of changes in behavior or speech patterns over time. If you become concerned about your symptoms or those of someone else, consult your primary care doctor, who can either diagnose the condition themselves through an objective test or refer the patient to a mental health professional who can conduct an assessment. Mental health myths have been around for centuries, and they are still being perpetuated. If you or someone you love is struggling with mental illness, please don't let these old wives' tales scare you into not seeking help. The more people speak out about their own experiences with mental illness, the less stigma surrounding them there will be. With that in mind, we hope this video has helped reduce some of your fears by debunking a few common myths about mental health disorders. What other myths would you add? Share your story with us in the comments. If you enjoyed this video, then don't forget to hit the like button, give it a thumbs up and subscribe to our channel. Spread the love and send this video to at least 2 friends or your favorite group chat. Sharing is caring after all. Be sure to hit the bell icon to stay up to date with our latest videos. Remember to be polite to yourself first, so you can be polite to others. Take care of yourself. Until next time.